personally, is there something which has led you to thinking about those psychiatric disorders so obviously with considerable detail, or is it just that any problem in the broadly scientific or medical world, is it?
Yeah, no, I guess I'm just a polymath, and you think about all these things at a practical level. I mean, look, I'm very much involved in medical research as a living, you know, and while my particular focus on my research is very, very specific, at a practical level I'm faced with the business of administering medical research through many different environments, through the National Health and Medical Research Council, where I actually have to sit on programme grants committees and make decisions about grants in the area of neurophysiology versus cancer versus heart disease, and rate relative worth of particular programmes, not on my own and not without expert advice, but you know, I have to be able to think across the breadth of that sort of area. And then outside in the real world, when you're talking to the community about medical research, you know you're working in an environment where their perception of medical research is broad, so you keep yourself up to speed in these areas. Plus, obviously, as a clinician, you know, I mean, my patients come in the door, or at least they did when I was still working as a clinician, which was until about 5 years ago, and they might have an immunology problem, but they probably would have several other problems as well. And I can't just say, well, I'm only your immunology doctor. You know, some doctors do that, but I suppose if you're a plastic surgeon, you can say, well, I'm only your plastic surgeon. But if you're a physician, you have to be a physician for the whole patient.